This is Toronto's Alpha Junior School. It's one of the city's alternative schools, where non-traditional teaching methods are practiced. According to public health data, more than 22% of students here are unvaccinated. It's the second highest rate in the city.
As a parent, does that concern you?
Not really. I understand why people choose not to vaccinate their children.
There's lots of issues of people concerned about some of the science, some of the effects of certain vaccinations.
A CBC News analysis looked at vaccination rates at Toronto public schools and found 10% or more of students at 12 schools received an exemption because of their parents' beliefs. All 12 were alternative schools.
If we had an exemption rate of, say, 10% across all schools in Toronto, we could definitely see outbreaks of measles.
Federal, provincial, and municipal health authorities all agree vaccines are critical in preventing the spread of infectious diseases like measles. Ontario, BC, and New Brunswick are the only provinces that mandate certain vaccines for school-aged children. But in all three, parents can still get an exemption based on their personal or religious beliefs. Part of the problem, according to health officials, misinformation on the dangers of vaccines that still persist.
That they do cause injury. Our government pretends that they don't.
A lot of it is false truths, and they've understood it and take it to heart, and they've chosen not to vaccinate their children.
Good job!
Rebecca Stonham is hoping to reach those parents. Her daughter nearly died after contracting whooping cough at 7 weeks, just days before she was scheduled to be vaccinated.
I think that for people that are just electing to not vaccinate their children for their own personal beliefs, I don't think that justifies enough of a reason to put other children at risk. You want to play with your tractor?
Toronto's chief medical health officer wants the province to only allow exemptions for medical reasons. Ontario's Minister of Health says it has no plans to change the current approach to vaccines. Farah Morelli, CBC News, Toronto.